Welcome to another edition of the Invisible Wheelchair Interview Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com, FocusedHealthyFamily.com, and of course, InvisibleWheelchair.com. In the Invisible Wheelchair interviews, I get the wonderful chance to interview some of the experts with obsessive-compulsive disorders, professionals that treat OCD, people who are going through or have been through OCD, parents and caregivers of those suffering from OCD, and of course anyone that advocates for treatment of OCD. My goal of these interviews is to inform people on all aspects of OCD and bring about awareness of obsessive-compulsive disorder. Please remember that I am not a doctor, therapist, or counselor, and the content, information, resources, and ideas that are talked about and brought up here in these interviews are not necessarily the views and opinions of myself, Family OCD, Focused Healthy Family, and Invisible Wheelchair Podcast, and I always recommend to seek additional professional help in finding solutions for yourself. You can find out more about me at FamilyOCD.com, FocusedHealthyFamily.com, and InvisibleWheelchair.com. This Invisible Wheelchair podcast interview was recorded November 17, 2017. Today I have the honor of introducing you to a friend and associate, Dr. Michael Smith. Dr. Michael Smith is a practicing naturopathic physician and founder of Carolina's Natural Health, a primary care practice. He has advanced training in classical homeopathy and clinical nutrition, and he helps people with conditions ranging from diabetes, autoimmune diseases, digestive disorders, anxiety, depression, and chronic fatigue. Dr. Smith has been recognized as a leader in the field of natural medicine by the Association of Accredited Naturopathic Medical Colleges and served as adjunct professor for the Southwest College of Naturopathic Medicine and University of North Carolina, Charlotte. The past president of the North Carolina Association of Naturopathic Physicians, where Dr. Smith continues to actively work towards licensing of naturopathic doctors in the state of North Carolina. Dr. Smith received his Doctor of Naturopathic Medicine from the Southwest College of Naturopathic Medicine in Tempe, Arizona, a 4-year postgraduate naturopathic medical program. Dr. Smith is passionate about health and leads an active life with his 3 amazing children. He lives in Matthews, North Carolina, where he mountain bikes, works out with F3, and shops regularly at the Matthews Farmers Market. Now, let's find out more about Dr. Smith. Let's go to that live interview. Well, Mike, I am so appreciative of you being here. I've admired your work for a long time. You and I have known each other for quite a while, and I've really admired your work. So I so much appreciate you being here on the Invisible Wheelchair Podcast with me.
Hey, Don, thank you. I appreciate the opportunity to share some of my experience with you and your audience.
So what I'd like to open up for you, Mike, now is that if you want to tell just a little bit about yourself, your story, and so the audience can get a better picture of who you are and what you do.
Sure. So I'm a naturopathic doctor, and for those that aren't familiar with that, we take a different approach in treating people, in that we focus on treating the individual rather than treating the symptom or illness or diagnosis that they have. And, our philosophy of medicine is we truly understand the body has this amazing God-given ability to heal. And so we focus on that. And we're often trying to figure out what's missing, what's in the way, what's not allowing the body to heal, so that we can help to support that process. It's really trying to determine the underlying root cause of someone's condition or illness, and rather than just trying to figure out what are some Band-Aids or temporary patches, we're really working with them to support their body's health and ultimate healing in that process. So for me, I'll share a little about my background, because it was never something that I thought I'd be a doctor, and didn't even know about naturopathic medicine. But I really became fascinated by nutrition when I was an athlete in college, and I saw how much nutrition really affected my performance. And so I just read every book I could find on nutrition. And the more that I learned, the more amazed and fascinated I was by it. And eventually I read a book written by an ND, and never heard of ND before, and looked it up and found naturopathic medicine. And at that point, I was really at a place in my life where I was looking for what I wanted to do, and already graduated undergraduate school and was out working in the workforce, and I was still trying to figure out where my true passion and desires lied. When I found naturopathic medicine, it just made sense. Like, that was exactly what I've been looking for. I wanted to be able to help people. I wanted to be able to work with people from a health standpoint, learn more about how our bodies work, because I just became so amazed by that. And, Don, I'll share with you an interesting story about my own personal health journey that I didn't really realize or put the pieces together until I was already through my journey with naturopathic medicine. But, my health journey really started when I was a teenager. I was being treated for acne and put on antibiotics. This is some 30 years ago, for the acne, in which back then was a really common treatment. And, the amazing thing today is still a really common treatment. I was on antibiotics for a couple of years, and it did help my skin, and I was grateful as a teenager back then for that improvement. But the thing I didn't realize and didn't put the pieces together until decades later was that it wrecked my gut. I share this with you because when I work with individuals, I'm often trying to understand kind of what's the health journey that they've been on. For myself, when I went to naturopathic medical school, at that point, my health had deteriorated pretty significantly, to the point where I was having chronic sinus infections 6 or 7 times a year. I had a fungal rash that covered most of my body. I just remember always having digestive symptoms. Probably would have been diagnosed with IBS if I went to see a doctor for it, but I just accepted it as normal. And this is just kind of the way things are. And it wasn't until I kind of learned more about how our body works through naturopathic medical school and started to put all those pieces together and realize that, wow, all these things are related, and I could trace them all back to when I had started on antibiotics, some 15, 20 years earlier, and just kind of set my whole health on a different path. Thankfully I was able to realize this and started to do the things I needed to do to repair my own health and put those pieces back in place. And I'm grateful for what I learned through naturopathic medicine to heal my own body, and to truly be at a place now where I don't have digestive symptoms any longer. I don't have sinus infections anymore. I can appreciate clear skin and no longer have a fungal rash on my body. But it's one of these things, as I've shared the story of the years, I find so many other people have had similar experiences but never kind of connected those dots. And so it's something that can be important to do. One of the things that we go through in our process is to understand, the path that led you to where you are today. Because, most of the time your current state of health is a culmination of everything in your life up to this point in time. And it's helpful for me as a practitioner to understand how we got to where we are.
What I would ask now is if you could explain what naturopathy is, so that people can understand what the principle is behind what you do.
Sure. Yeah, so naturopathy is a whole separate system of medicine, or philosophy, and our approach to medicine. One where we understand that the body has an ability to heal, and we focus on that. So in our training as naturopathic doctors, we are trained as primary care physicians, so we have the same level of medical training as an MD in family practice. But instead of being trained through a lens of sickness or illness, we're really trained through a lens of health. And what I mean by that is we really focus on understanding how all aspects of the body work, how all of our different systems that we're trained in the body all work together. And unfortunately in conventional medicine, these doctors become so specialized, where you have one doctor that treats your skin, one that treats your guts, one that treats your heart, one that treats your eyes, one that treats your kidneys, and no one's actually treating you. How our bodies are truly designed is that all these parts work together and they all affect each other. And so you can't just separate us into these different parts and pieces and expect that we're going to achieve true health and healing. So when we work with people as naturopathic doctors, we're really looking to understand all the different ways in which their body is expressing the underlying dis-ease in them, and then working to figure out where that comes from and helping to resolve that. So one simple example I can give you is, I might see a patient that comes in to see me and they have migraines. And that might be the thing that drives in my office. But in addition to that, they also have constipation and they have eczema. In the conventional medical world, these are 3 different diagnoses. There are 3 different conditions. They get 3 different treatments, possibly even 3 different doctors. For me, there are 3 different presentations of the same underlying disease in the person. And that's what we're here to figure out and help to put those pieces back in place. And so someone might come down to looking at their lifestyle and nutrition and what foods might be impacting them. Looking at the stressors in their life and how can we help them to overcome or resolve those. Looking at different neurotransmitter balance in the body and how those things are impacting their mood and mental function. And so we can look at all these different components and really help to put those pieces back in place. And as naturopathic doctors, we are well trained beyond the medical stuff. We're well trained in different modalities, nutrition being a huge part of that. And more training in nutrition than any other profession out there. Homeopathy, which is one of the areas I specialize in, that really helps to stimulate our body's own healing. Homeopathy is a whole separate system of natural medicine that works in a very gentle way that can stimulate our body's ability to heal and help to kind of heal it from the inside out. So we're not having to continually rely on medicines lifelong, but we can help to correct the underlying susceptibility in someone that's allowing these symptoms or conditions to show up. We're also well trained in botanical medicine, using herbs to help the body heal, nutritional supplementation, hydrotherapy, which is useful in using just water, different hydrotherapy techniques to help support the body's healing, counseling, as well as other natural modalities. But it's not so much the modality that we're trained in, it's the approach that we take to help in really finding the problem and fixing that, as opposed to just trying to treat the symptom.
What would you say would be some of the, at least one of the obstacles you run into when in the work you do?
In terms of like obstacles that we have, probably the biggest one is helping people to realize that they can't continue to rely on the healthcare system for the answer. I think we've created a society and a culture that expects that when they're sick, they go to their primary doctor, they pull out their insurance card, and the doctor's going to give them a solution that's going to fix them. And the reality is that's not how our bodies work. We have a healthcare system that no longer focuses on health, but truly focuses on sickness, illness, and disease, and is heavily pharmaceutically driven. And the reality is that there's a time and place for drugs, and I'm not against them, but there's no drug in the world that improves health. And so if you want more health, you can't expect that the drug your doctor is going to recommend to you is going to help you get there. And so what that really requires is a shift in mindset, realizing that we need to be investing in our health on an ongoing basis. I agree, as I know you do, and hopefully your listeners do as well, that your health is your most valuable asset. And if we're operating from that mindset that your health is your most valuable asset, the question I have is, well, in what way are you investing in it on a daily, weekly, and monthly basis? Because oftentimes, we're deciding every time we bring our fork to our mouth, are we investing in our health, or are we subsidizing our illness? Yeah, we often know the answer to that.
Yeah. Well, since we're, this Invisible Wheelchair podcast is focused towards OCD and anxiety, what I was going to ask you, because you did some really wonderful work with my daughter. You helped us out a lot during our worst time with the OCD, and the things you did for her in a natural way really helped. And so I was wondering if you wouldn't mind kind of going through your thought process, your method or process that you used in working with my daughter and treating the OCD.
Yeah, so when I work with people with OCD, it's always trying to understand that path, how we got to where we are right now. And oftentimes there's different stressors that the person may be experiencing. Some of those might be internal, some of them may be external, and also understanding kind of the family dynamics, things that may be influencing them. And so it's understanding kind of their current state of health, how they got to where they are, and any stressors that they may be experiencing. Now, they may not always be aware of some of these things. And when I talk about stressors, there's lots of different types of stress that our body experiences. And these things, that we look at may be relationship stress and environmental stress, emotional stress, lack of sleep stress, nutrition stress. These are all different stressors that can be contributing to the imbalance in health that someone may be experiencing, that's causing or bringing out the OCD symptom. And I think it's always important to be able to talk through these and have a dialogue with them, or if they're a child, certainly with them and their parents, as we're getting clarity around the OCD. And then, a couple of the areas that I always look at, so food is a huge one, in understanding how they're affecting someone. Because a lot of times people don't realize that food can be triggering or causing an imbalance in some of the neurotransmitters in the body. So one of the things we do is look at is food sensitivities. We do it through a simple blood test that can help to identify certain foods that might be triggering different reactions in the body, often causing inflammation and causing disruption in normal levels of neurotransmitters. Because most of the neurotransmitters are produced in our gut. People may not always realize is the gut's also referred to as a second brain, because it has the highest concentrations of neurons and also the greatest production of neurotransmitters in the body outside the brain. So it directly affects our mood, our mental function, and I work with people with OCD or anxiety or things like that. First place I start is with the gut to help and to correct that. And then from there, we also can do testing on looking at neurotransmitter levels in the body, so we can identify if there's certain areas of deficiency and help to focus on improving or correcting those imbalances. In addition to that, as we've done as well with your daughter, Don, is utilize homeopathy, which, as I mentioned, is a very specific system of medicine that uses all natural substances that are extremely safe and work in a way that can help to stimulate the body's healing. So we can start to see improvements with homeopathy that are real, because the body's actually doing the healing work on its own with that.
Yeah, I remember, one of the things when I talked to people about OCD and when I talked about what you did, one of the things I saw, and you kind of touched on that, is that you went deeper in testing than most medical doctors would go. You got us down to levels of, like you say, the transmitter levels, the GABA levels, all of that are so important, GABA and serotonin levels, all of that are so important in OCD. And you were able to, pinpoint those, and we, through both herbal medicines and the homeopathy that we worked with, we were able to rebalance those levels. So I always talk about, you do deeper testing than you would get from just going into your primary care or whatever. So I felt that was very, very important, because it changed her diet, and through that diet, with my, I don't, you probably remember this. I mean, her anxiety, she was very aggressive and angry, and the anxiety was off the roof. We cut out some of the foods, and within a short period, that cut down probably by half of the violence we were going through with her. She was, so yeah, that was impressive, and that's always stuck in my mind, and that's what I tell people. That's at least one of the things that I know you did that was very different than what a medical doctor would do. So, and I always thank you for that. So,
Well, no, but you're right on, Don, and that, the testing is a key piece, because most doctors, the testing that they're doing is really cursory, not really, or we're not even testing the right things. And how often do patients go to the doctor because they don't feel right, and the doctor runs some tests and tells them, oh, everything looks good. It's like, but wait a minute, I don't feel right.
Yeah.
We need to make sure we're focused on the right things and doing the right testing to identify the real issues.
Just for the audience's sake, what is it you kind of focus on? I know OCD isn't your main focus. I understand that, but you've worked with more than just one or two of those. But what is it that you commonly treat?
So, beyond OCD, anxiety and depression are pretty common things that I see in my practice. Those are often correlated with OCD. Digestive disorders of all sorts, constipation, diarrhea, IBS, IBD, Crohn's colitis, autoimmune disease. I tend to see a lot of autoimmune diseases these days, and also kind of what I just call immune dysfunction. Everything from allergies, eczema, asthma to autoimmune diseases, and then diabetes. Those are probably the biggies that I tend to see pretty regularly in my practice.
Well, Mike, the last thing I was going to ask you, if you want to let my audience know what's kind of the best way to find out more about you, get a hold of you, however you wish to put that out. I will also, just as a reminder to the audience, I will have his information on my Invisible Wheelchair podcast site and also on my Family OCD site, so you can find that information there. But Mike, share with me what you wish to the audience to know and how to find out more about you.
Sure. Yeah, definitely. So the best way would be to go online to our website, which is Carolinas with an S, carolinasnaturalhealth.com. You can go to our website, or you can also find us on Facebook under the same name, Carolinas Natural Health. And there you can learn more about our practice. You can also reach out to us or attend one of our upcoming seminars.
Well, Mike, again, thank you so much for taking this time. Like I say, I enjoy talking with you, and I think, we could probably go on a day and a half talking about all this, about the natural world and how to cure it. So I appreciate you taking a few minutes to really just to give some bits and pieces about what you do, so people can now then take it and learn more about you. So again, thank you for being part of this.
Yeah, you're welcome, Don. It's been a pleasure. It's been awesome to work with you and your family over the years, and I think it's phenomenal that you're doing this and providing this as additional resource for families that are dealing with OCD as well.
That concludes this interview podcast. Please leave me a comment or question below. That gives me good direction where to go on future podcasts and interviews. I would love to hear your invisible wheelchair stories if you are willing to share it. If you would go to invisiblewheelchair.com and click on Tell Your Story. I want to remind you that OCD, Obsessive Compulsive Disorder, is treatable. I can help you get past OCD. So, if you have heard this interview podcast and other podcasts, and you feel like you need further assistance and would like to spend some time with me working through any issues you have, then feel free to book a session at focusedhealthyfamily.com or familyocd.com, or call me at 704-562-1630. I also offer $85 off of your initial discovery session if you mention that you heard it on this podcast. I hope you enjoyed this interview podcast and will join me for the next one. Remember, keep tapping, talking, and transcending your life to new heights. Thank you, and have a great day.